Welcome to the annual training on abuse and fraud in home care. Part 1 of the training focuses on abuse, neglect, and exploitation. Abuse training is important to Lrhc as we serve older people and persons with disabilities. According to a study done in 2012 by the World Health Organization, persons with disabilities are more vulnerable to violence, abuse, and exploitation. LHC asks that personal care attendants be our eyes and ears when servicing consumers. This training aims to help personal care attendants to identify abuse, neglect, and exploitation. Abuse is defined as any action that intentionally harms or injures another person. However, abuse is a much more complex concept than the definition speaks to. Abuse almost always means one person exerting control, whether psychologically, financially, socially, or physically, over another. For this training, we will be covering physical, sexual, financial, psychological, and modern slavery abuse. Physical abuse can be defined as a non accidental use of force that results in bodily injury, pain, or impairment. Types of physical abuse includes assault, hitting, slapping, burning, withholding of food, or physical restraints. Signs of physical abuse can be frequent injuries, unexplained falls, or signs of malnutrition. Sexual abuse is unwanted sexual activity, with perpetrators using force, making threats, or taking advantage of victims not able to give consent. Types of sexual abuse includes rape, inappropriate touching, sexual harassment, forced pornography, among other things. And signs of sexual abuse includes bruising in the buttocks or inner thighs, pain and itching in the genitals, unexplained STDs, etc. Financial abuse, also called material abuse, is defined as the misappropriation of property, possessions, or benefits. Types of financial abuse includes theft, fraud, internet scamming, duress in relation to an adult's will, property inheritance, or financial transactions. Signs of financial abuse includes missing personal possessions, unexplained lack of funds, family members showing unusual interest in the assets of the person, or recent changes in deeds or title to property, rent arrears, or eviction notices. Psychological abuse, often called emotional abuse, is a form of abuse where one person subjects or exposes another person to behavior that may result in psychological trauma. Types of psychological abuse includes enforced isolation, removing mobility or communication aids, failure to respect privacy, or intimidation. Signs of psychological abuse includes withdrawal or changes in the psychological state of the person, insomnia, low self-esteem, uncooperative or aggressive behavior, or appetite changes. The final type of abuse that we'll be looking at is modern slavery abuse. Modern slavery abuse is an illegal form of exploitation of people for personal or commercial gain. It involves recruitment, movement, harboring, or receiving of children, women, or men using force. Types of modern slavery abuse includes human trafficking, forced labor, domestic servitude, sexual exploitation, or debt bondage. Signs of modern slavery abuse include appearing to be malnourished, isolation from the community, living in dirty, cramped, or overcrowded accommodations, or lack of identification documents. Neglect is one form of abuse. It is defined as disregarding, ignoring, or overlooking something that requires your attention. In our case, our consumers. There are two types of neglect: active neglect, which is deliberate, and passive neglect occurs as a result of forgetting or being under pressure or overwhelmed. Examples of active neglect includes failure to report duties on a consumer's care plan, ignoring requests for assistance, refusing to clean the consumer, or not showing up for your shift. Examples of passive neglect could include skipping over a task on your consumer's care plan because you got overwhelmed with other tasks. As personal care attendants, you should be aware of self neglect in consumers. Self neglect is when someone is unwilling to attend to their personal needs. It can be caused by dementia, cognitive impairment, psychosis, or depression. Signs of self neglect are not eating, not taking care of personal hygiene, not taking medication. If you witness or suspect self neglect in a consumer, please report it to the scheduler. Another form of abuse is exploitation. Exploitation can be defined as knowingly acting in deliberate ignorance by deception or intimidation, obtaining or using or attempting to obtain or use a vulnerable adult's funds, assets, or property with the intent to deprive them of these benefits. And in our case, vulnerable adults means our consumers, or specifically, a person age 18 or older whose ability to perform normal activities of daily living is impaired. Risk factors of exploitation includes age, disability, illness, isolation, finances, living conditions. Types of exploitation can be illegally withdrawing money from a vulnerable adult's account, forging checks, or stealing from a vulnerable adult. Signs of exploitation includes sudden changes in bank account or bank practices, abrupt changes in will, or unexplained sudden transfer of assets. Next, we'll look at the laws against abuse, neglect, and exploitation of vulnerable adults. Act 28 was enacted in 1995 to protect care dependent persons from being abused or restrained at the hands of their caretakers. It is the law against intentionally, knowingly, or recklessly causing bodily injury or serious bodily injury to a care dependent person, or intentionally or knowingly using any type of restraint on a care dependent person. Act 70 was enacted in 2010 specifically to protect vulnerable adults between the ages of 18 and 59. It established a program to detect, prevent, reduce, and eliminate abuse, neglect, and exploitation. Act 13 was passed in 1997, and this act states that any suspicion of abuse, neglect, and exploitation should be reported by law. It was enacted to encourage the reporting of abuse against vulnerable adults. Mandatory reporters include home care workers, nurses, physicians, paramedics, etc. Here is a resource guide to agencies instrumental in assisting PAs most vulnerable. The Philadelphia Corporation for Aging, Department of Behavioral Health and Developmental Services, Advocacy Council for Persons with Disabilities, Office of Long-Term Living, PA Office of the Attorney General, PA Department of Human Services, or Law Enforcement and PA State Attorney General's Office. The next half of this training focuses on fraud, waste, and financial abuse. Why is fraud training important to LRHC? The primary purpose of home care programs and services is to provide quality care for persons with disabilities, persons with chronic medical conditions, or the elderly in the comfort of their homes. Home care is backed by a combination of federal and state government funding, specifically Medicaid and Medicare. These programs are very vulnerable to fraud. As the home care industry grows, so does the growing concern in the rise of fraud. The first definition that we'll review is waste or financial waste. Waste is an overutilization or misuse of funds or benefits that results in unnecessary expense to Medicaid and to Medicare. Examples of waste includes charging in excess of services or supplies provided, billing for items or services that should not be paid for by Medicaid or Medicare, or when a consumer is authorized for more hours than they actually need. Next is financial abuse. Financial abuse describes practices that may directly or indirectly result in unnecessary costs to Medicaid and Medicare programs. Examples of financial abuse includes repeated duplication of services, failing to discontinue services even when they are no longer necessary, providing unnecessary medical services or equipment, or referral to home health care services when it is not medically necessary. Next is fraud. Fraud is defined as any lie, misrepresentation, or false statement made by a person or group of people with the intent to gain benefits. We will now be looking at some common fraud offenses in home care. The first one is double dipping, and this is to receive income from two places illegally or being paid more than once for the same job. The second is falsification of time. Attendants must refrain from providing inaccurate times or inaccurate data for the start or end of your shift. If an attendant is running late to a shift, please notify your assigned scheduler for support. Another common home care fraud offense is splitting checks. Splitting checks with consumers are frowned upon and regarded as fraudulent. Attendants must not engage in these acts with their consumers. If a consumer suggests a split check arrangement, do not engage. Immediately report it to the agency. Clocking in and out while consumer is in the hospital. When a consumer is admitted into a hospital or an inpatient rehabilitation center, the home care service is placed on pause until a discharge is carried out and the consumer is returned home. Attendants should report any consumer hospitalizations to the agency and must refrain from clocking in and out throughout this period. Laws against fraud, waste, and financial abuse. The False Claims Act was enacted in 1863 during the Civil War to combat the fraud being carried out by certain companies that supplied the Union Army with weapons and horses, etc. Some weapons dealers were lying and misrepresenting by accepting payment then shipping empty crates to the Army. The False Claims Act is still very much relevant and is being applied to all industries, or is being used in all industries. In terms of healthcare, the False Claims Act is a federal law that makes it a crime for any person or organization to knowingly make a false record or file a false claim regarding any federal healthcare program. Under the False Claims Act, there is a whistleblower provision protection. A whistleblower is someone who signs up to report ethical wrongdoing or unacceptably dangerous acts within an organization. Attendants who report fraud are considered whistleblowers and are therefore protected under the whistleblower provision of the False Claims Act. The next law is the PA Fraud and Abuse Control Act, also known as the Medicare Fraud and Abuse Control Act. This law was passed in 1978, and under this law, it is a crime to submit false or fraudulent claims to the PA Medicaid systems. Penalties for fraud. If found liable under the False Claims Act, a person can be fined between 5,000 and 11,000, or be asked to pay 3 times the amount of each false claim. If found liable under the state, a person can be asked to pay up to 15,000 for the first offense and 25,000 for the second offense. The state can also request a repayment of each fraudulent claim plus interest, or a repayment of 3 times the amount of each false claim. PA criminal penalties include up to 7 years for the first offense and 10 years for the second offense. Department of Human Services may also impose penalties of requesting repayment of 2 times the amount of each false claim plus interest. Fraud conviction may result in exclusion from Medicaid participation for a minimum of 5 years. In addition, if an attendant is found liable for fraud, they will go through disciplinary action leading to termination from employment. Lrhc prevents and minimizes fraud by adhering to documentation standards, requiring employees to abide by laws, regulations, and policies, retaining a quality assurance manager to conduct periodic internal audits of our programs and services, conducting fraud trainings during new hire orientation and in-service trainings or annual compliance trainings. Billing errors are promptly handled through corrective action plans. How to report fraud, waste, and abuse. All Lrhc employees have a variety of internal reporting options to resolve concerns relating to fraud, waste, and abuse. Any concern or question should be shared with your scheduler, scheduling manager, or any member of the Lrhc leadership team. If that is not an option, employees should contact the quality assurance manager at Liberty Resources. It is prohibited to retaliate against any person who reports in good faith an actual or perceived violation of the False Claims Act or other applicable laws, regulations, or policies. Reports of suspected retaliation will be investigated according to the process set out in LRI's non-retaliation policy. The non-retaliation policy falls under the whistleblower provision of the False Claims Act. The whistleblower provision or protection of the False Claims Act provides for reinstatement, twice the amount of back pay with interest, and litigation costs and attorney fees if an employer discriminates against an employee for acting under the False Claims Act. When fraud or suspected fraud is reported to the agency, a preliminary report is written and sent to the quality assurance team. Quality assurance will conduct an internal investigation. If the results of the investigation confirms that fraud was in fact committed, a final report will be sent to the Bureau of Program Integrity, or the BPI. The BPI is a program that was put in place by the Department of Human Services to protect Medicaid programs against fraud, waste, and financial abuse. BPI ensures that Medicaid recipients receive quality services and also ensures that Medicaid recipients do not abuse or overuse the services provided. You have completed your yearly abuse and fraud training. Thank you.